Today we are going to study and discuss about the arterial supply of upper limb. Let's get into the topic right away. So let's start from the arch of aorta, right, which is coming from the left ventricle. Now from the arch of aorta, you have on the right side, you have right brachiocephalic trunk, correct? And on the left side, you have the subclavian artery coming directly from the arch of aorta, and then the left common carotid, right? Now on the right side, from the brachiocephalic trunk, you have the right subclavian and the right side common carotid artery, right? So now the right subclavian is divided into three parts. This is divided by your muscle coming from the transverse process of C3 to C6, which is your scalenus muscle, right? The scalenus muscle, it divides your subclavian artery into three parts, right? So this is your first part. The artery below the scalenus anterior is the second part, and this is your third part, which extends till your first rib, correct? So the subclavian artery is divided into three parts, right? Now the three parts have different branches. The first part has three branches. Those are your vertebral artery, your thyrocervical trunk, and your internal thoracic artery, right? Or rather VIT. So vertebral artery, internal thoracic, and thyrocervical. Your second part, which lies below your scalenus anterior, gives off costocervicular, single branch, costocervical branch, and your third part gives dorsal scapular artery, right? Now as it continues as your axillary artery, right? Your axillary artery, it extends from the outer border of your first rib, right? It extends from the outer border of your first rib to the teres major, lower border of your teres major muscle, right? So extension is from outer border of first rib to lower border of teres major, right? Now this axillary artery is also divided into three parts, right? Axillary artery, right? Three parts, 1, 2, and 3. Now the first part, now how is it divided? It is divided by your pectoralis minor here, which is inserted in your coracoid process, right? This is, let's assume this is your pectoralis minor. This is the muscle. So the first part is between the outer border of your first rib and the pectoralis minor muscle. So this is your first part, right? The second part lies below your pectoralis minor, and your third part is between your pectoralis minor or below the pectoralis minor and extends till your lower border of teres major, right? Now what are the branches of axillary artery, right? Now let's say the first part, the second, and the third part, right? The first part has one branch, the second has two, and the third has three branches, right? Now what are they? The first branch is your suprathoracic artery. From the second part gives off two branches, that is your thoracoacromium or acromium thoracic artery, and then your lateral thoracic artery, right? The third part gives off three branches. They are anterior circumflex, posterior circumflex, and subscapular. Yes, so these are your branches of your axillary. So now let's see these in the picture, right? A small recap. So now from your arch of aorta, so this is your right brachiocephalic trunk, which is giving off common carotid and right subclavian. So right subclavian is divided into three parts by your scalenus anterior, and then it continues as axillary. Your axillary artery is being divided into three parts again by pectoralis minor, and then continues as brachial artery, right? So let's just see the branches, right? So now this is your thyrocervical trunk. Okay, your thyrocervical trunk gives off four branches. Your first one is your clavicular branch, the second one is your acromial branch, the third is your pectoral branch, right? And your deltoid branch, which is coming from here, right? So your thyrocervical gives four branches, that is pectoral, deltoid, acromial, and clavicular branch, right? So this is your pectoralis minor, which is dividing into the first, the second part, the first part, the second part, and the third part, right? Where you'll have your teres major coming here. So this will, so your it extends till here, right? So this is your circumflex, anterior and posterior circumflex, which supplies your surgical neck of your humerus, right? And the last branch is your subscapular artery, which runs along the lateral border of your scapula, supplying your subscapularis muscle. Now coming to the, now as your axillary artery descends, it descends to form the brachial artery, right? Now your brachial artery extends from the lower border of teres major till your cubital fossa at the level of the neck of your radius. Let's say this is your neck of a radius, so this is within the cubital fossa, right? So this is the extension of your brachial artery. Now your brachial are now its branches. Your brachial artery first gives off a branch in its upper 1/3. This is your profunda brachii artery, okay, which runs along your radial nerve or accompanies your radial nerve, right? As it descends, it gives off two ulnar branches, and these are called as collateral branches. Collateral branches, right? So they are your superior collateral. This goes superior collateral. This goes posteriorly, hence I'm drawing that with a dotted line. And then your inferior ulnar collateral. So this is your superior ulnar collateral, and this is your inferior ulnar collateral, right? On the radial side, on the lateral side, your profunda brachii gives off two branches. One is your posterior branch again, and an anterior branch, right? So your posterior branch, these are called as descending arteries, right? So this is your anterior descending artery, and this dotted line is your posterior descending artery. Yes, so as your brachial artery continues, they terminate at the region where this divides into two terminal branches, giving off your ulnar artery and your radial artery. Yes, so this is your brachial arteries, branches and extension. So now let's understand this in this picture. So now this is your brachial artery, which is a continuation of your axillary artery. It is giving a nutrient branch, right, to the humerus. That's the first thing. The second thing is your profunda brachii, which is dividing into two, your anterior and your posterior division, right? As we go on the medial aspect, you have your superior ulnar collateral, which is in the posterior aspect, and a little further down you'll find your inferior ulnar collateral. These are your descending branches and these are your collateral branches, right? So now once we enter into the forearm gets the blood supply mainly from your ulnar and your radial artery. So let's assume this is your brachial. Now this is your ulnar artery, okay, which is the larger branch of your brachial artery, and the smaller branch is your radial artery, right? So there is another branch coming from your ulnar artery. This is called as your common interosseous artery, right? Your common interosseous artery divides into two, giving an anterior branch and a posterior branch. So this is your anterior branch and this is your posterior branch, right? So before we go down further, now let's understand there is an anastomosis which forms around your elbow joint. So now these anastomoses join the collaterals, ulnar collaterals and your descending arteries, which are joined by recurrent arteries. So where are these recurrent arteries coming from? So from your ulnar artery you have recurrent arteries going upwards, right? So hence the name recurrent artery, because it's going back, it's taking a turn, right? So your superior ulnar collateral joins your posterior ulnar recurrent, right? And your anterior ulnar recurrent joins your inferior ulnar collateral. This is your inferior ulnar collateral. This is your anterior or the recurrent ulnar, anterior recurrent ulnar, right? This is your posterior ulnar recurrent joining your superior ulnar collateral. Now on the lateral side, on the lateral aspect, where you have your descending branches coming, so now let me draw it separately. So now this is your profunda brachii dividing into two branches. This is your posterior and this is your anterior branch. Now let's say this is your ulnar artery and this is your radial artery, right? So you have a radial recurrent and a radial recurrent joining your anterior descending artery, right? And now there is another recurrent artery which is coming from your common interosseous artery. So this is your common interosseous artery. Now there is a recurrent artery which is coming from your common interosseous artery. This is called as the middle collateral, which joins with your posterior descending artery coming from your profunda brachii, right? So these anastomosis, they supply your elbow joint, right? Now let's try and understand this in this picture. So this is your profunda brachii, which is going posteriorly along your radial nerve, and then it gives off two branches. This is the anterior branch and this is your posterior branch. Your brachial artery, which gives off two branches, which is your superior ulnar collateral and your inferior ulnar collateral. So as we go down, so the superior ulnar collateral is joining your posterior ulnar recurrent, and your inferior is joining the anterior branch, right? And your common intraossei, this is your common intraossei. So common intraosseous recurrent is joining your posterior descending, and your anterior descending is anastomosing with your radial recurrent. Yes. So now the arteries, we are with the arteries we are entering into the forearm, right? Now when we enter into the forearm, so now as we all know, this is your ulnar artery, this is your radial artery, and this is your common intraosseous artery. This is giving off two branches. This is your anterior and posterior branch. Your anterior is runs along your intraosseous membrane, and your posterior goes to your extensor compartment, runs between your superficial and deep muscles. So your posterior branch runs between your superficial and deep muscles of your extensor compartment, right? So your radial artery, it forms a lateral convex curve and reaches your wrist joint, and at the wrist joint it passes through your anatomical snuff box and goes posteriorly to form your deep palmar arch, right? Whereas your ulnar artery, it runs medially, obliquely and medially, and then it goes straight down vertically, superficial to your flexor retinaculum, and then thereby forming your superficial palmar arch, right? Yeah. So this will be joined by your radial artery here, and this is your, let's say this is your deep. So your superficial palmar arch is by ulnar, and deep is by radial, right? So now let's understand this with this diagram. So this is your ulnar artery. So it goes down and it continues. Yes. So it's going down, and this, yeah. So this is giving off branches to your digits, right? So your superficial palmar arch is formed predominantly by your ulnar artery. So the ones which I'm marking now is your superficial arch, right? So it is giving off number one digital arteries, right? And this is the second between the third, fifth and the fourth digit. So it gives off a medial branch and a lateral branch to the respective digits. So this is, again, I'm highlighting them. Yes. So your superficial arch supplies the 3.5 medial digits. So this is 1, this is 2, 3 and half, and this is the half, right? Now for the indices, that is your index finger, for your index finger and your thumb, your arteries, they are marked in blue. Yes, I will highlight them now so you can see them. This is coming from your deep palmar arch. Now before I show you, let me show you how the deep palmar arch is formed. I'm going to mark it with yellow, right? So now this is your radial side. So your radial artery predominantly forms the deep palmar arch, right? You can see this. And gives off branches to your indices and your pollicis, your thumb, right? So therefore, now let's understand this once again. Your ulnar artery, just a minute. Yeah, so your ulnar artery, it forms the superficial, right? This is the superficial arch, and your radial artery is forming your deep palmar arch, right? Now we've got your blood supply to your digits and your wrist joint. Now where do the metacarpals get from? Now your metacarpals, I'm going to mark it with green. So they have branches between the second, third and the fourth metacarpals coming from your deep palmar arch. I'm marking them with green. I'm highlighting them. So these branches are anastomosing with your common digital arteries. Yeah, so these are your common digital arteries, and as you can see, your metacarpal branches, they anastomose with your common digital arteries, therefore supplying your palmar region and your metacarpal region, also including all their muscles, right? So this ends your blood supply with your of your upper limb, right? So we can revise this with the picture. So I'll use black. So as you can see, this is your ulnar artery forming the superficial arch, so giving off digital branches, okay, and giving off medial and lateral branches, right? And this is your deep palmar arch coming from your radial artery, giving off princeps pollicis and a branch to your indices, right? So the ones which are curved behind in dotted, these are your metacarpal branches coming from your deep palmar arch. As you can see, they are anastomosing with your common digital arteries. Yes, with this we come to the end of this presentation. Thank you.